Good evening and welcome to tonight's WU University webinar, Eyelid Hygiene from Office Education and Product Dispensing to Increasing Patient Compliance at Home with Dr. Elise Kramer. I'm your host, Dr. Jennifer Stewart. It's my great pleasure to introduce Dr. Elise Kramer. She's a residency-trained optometrist in Miami, Florida, who specializes in ocular surface disease and specialty contact lens design and fitting. Her doctorate degree was awarded in optometry from the University of Montreal in 2012. She went on to complete her residency at the Miami VA Medical Center. Her time there included training at the Bascom Palmer Eye Institute, the nation's top eye hospital. After her residency, she became a fellow of the Scleral Lens Education Society and now serves as the secretary for the SLS. She's a member of the AOA, the International Association of Contact Lens Educators, a fellow of the American Academy of Optometry, and of the British Contact Lens Association. She's also a delegate of the International Relations for the Italian Association of Scleral Lenses. She's published several important articles and reviews and participates in clinical research trials. She enjoys lecturing all around the world in several different languages about ocular surface disease and specialty lenses. Welcome, Dr. Kramer.
Thank you so much for having me. It's a true honor. And thank you, Avanova, as well. So these are my relevant financial relationships, which have all been mitigated. And if you have any questions, you can always send me an email. I'm happy to answer. So let's get right into it. So we talk about eyelid health. It's definitely a hot topic today. Obviously, dry eye, everything associated with ocular surface disease, contact lenses. This is all extremely relevant in the profession of optometry, ophthalmology as well, and eye care in general. So, it used to be that when we talked about eyelid health, it was all about eyelid cleansing, just cleaning the area, maintaining good hygiene. And now we know that it's more about a complete program and not just eyelid cleansing, but also screening, risk assessment, patient education, and coaching, and emphasis on coaching, because that's really what we are there for. We're there to guide our patients, assess risk, and obviously educate them, but also coach them. So make sure that we follow them, make sure that we check with them that they're doing proper hygiene, that they're following protocols, that they're not replacing products that we recommend with other products of their choice or other generic products or products that are on sale or whatnot that they find or that they want to do. So it's always important to check with them, coach them, make sure that they're following our protocol. And so when we talk about the healthy eyelid, I mean, this is definitely something that is neglected in a lot in our education or a lot in clinic. And it takes, I guess, a motivated eye care practitioner to come back and say, I want to learn more about the ocular surface. I want to learn more about the eyelid. But it definitely requires attention, because a lot of the structures in the eyelid and around the eyelid, the tears are there in order to protect the ocular surface. And when we talk about the tear film, we know we have those three important layers, which are actually mixed together. And the meibomian glands, we know a lot about meibomian gland dysfunction now, but basically all of these things that are in and around the lacrimal system or are basically protecting the eye from injury, protecting the cornea, which, as we know, is one of the most important parts of the ocular surface. So in the 2007 dry eye workshop, they talked about the lacrimal system. The lacrimal system involves the lacrimal gland. It involves the ocular surface, which basically includes the cornea, the meibomian glands, the conjunctiva, and then there's the eyelid itself. And so all these things are working together in order to protect the eye, in order to provide vision. And vision is really the number one reason why people come in. But oftentimes, if the structures around the eye are not functioning properly or not in symbiosis, then we can have issues with our vision. And so the main goal of hygiene is to prevent anything from affecting or injuring the ocular surface. So with many ophthalmic disorders, even a small degree of dysfunction can have very significant impact on quality of life and the ability to carry out normal daily tasks. We know that the the goal is always to protect the cornea. We know that the cornea is it is the exposed organ that is the most sensitive in the human body, that is the most prone to be injured because it is extremely fragile. And so if our lacrimal system or our eyelids or the lacrimal gland or the tears are not functioning properly, then there could be devastating consequences on the ocular surface. And so it's super important to keep these things healthy and maintain hygiene of this area. And this is really what we're going to be focusing on tonight, is how do we protect disease? How do we prevent injury in these structures? So when we talk about eyelid disorders, we know that there are several. And what's interesting about these, when we talk about meibomian gland dysfunction, anterior blepharitis, dry eye syndrome, allergies, dermatological conditions like psoriasis, atopic dermatitis, and contact lenses, these are all interacting. We know that, for example, anterior blepharitis can have an impact on meibomian gland health and can cause meibomian gland dropout. We know that when inflammation is there, whether it's from anterior blepharitis or meibomian gland dysfunction, it can cause dry eye syndrome. And we know that dry eye can further exacerbate inflammation, which can cause further meibomian gland dysfunction, further blepharitis. We know that allergy is also inflammatory and can contribute and add to the inflammation that's already present with dry eye syndrome or meibomian gland dysfunction or blepharitis. Dermatological conditions, atopy, are also inflammatory. And so all of these things can also contribute. Dermatological conditions can also affect meibomian gland health, can also cause blepharitis. And then contact lens itself is a foreign body that we're putting on the ocular surface. And so it can exacerbate evaporation of the tears. It can lower tear film quality. Of course, if we optimize the ocular surface, anyone could be a candidate for a contact lens. But a contact lens itself alone can actually exacerbate evaporation, can actually lower the tear film stability. And so all of these things interact with each other, and all of them have to be addressed if they're present. And some of them are causes, some of them are consequences, but they're all related. And that's what's really interesting about these eyelid disorders. So let's talk about meibomian gland dysfunction for a minute. So how do we recognize this? When we look at the eyelid margin, you'll see what's called a toothpaste sign. And this is when the meibum that's coming out of the gland, that's being excreted from the gland, is actually very thick. It's thick, it's sebaceous, it's not watery, it's not liquidy, it's not oily the way it should be. So you can see how this being the main contributor to the lipid layer of the tear film, if the glands are producing meibum of this type of quality, you can easily see that it's not going to spread over the ocular surface in a way that it will prevent evaporation. The goal of the meibomian glands is really to produce oil, which then spreads over the ocular surface, preventing evaporation of the aqueous layer, right? So if you have toothpaste type of turbid, just meibomian meibum, then it will not be successful in its function of preventing evaporation of the ocular surface, of the tears on the ocular surface. And so what happens is then you can have excessive evaporation of your tears, and then inflammation, which is caused by tear film instability. And inflammation will lead to more tear film instability, and inflammation will also exacerbate meibomian gland dysfunction. So it's just a vicious cycle, and we can see how, if it's not interrupted, and if you see that this, for example, if you find a patient with this type of eyelid in your office and it is not addressed, then you can see how, even if this person is asymptomatic, when you see them, you can see how quickly those symptoms will onset, and how, let's say you're trying to fit a patient like this in contact lenses, how difficult it might become. So it's very important to address this, even if your patient is asymptomatic. I'm just going to grab charger. Sorry. Don't want to lose battery here. So there's a couple of ways to look at the meibomian gland, the meibum. And so these two ways that you see here are very, very different. So we're going to look at both of them. The top video is showing what's called a meibomian gland evaluator. So the meibomian gland evaluator is by J&J, and it's putting very, very minimal pressure on the eyelid. And what you're trying to do in that case is you're trying to see if the orifice of the meibomian gland is patent. Basically, if it's allowing oil to come up or if it's blocked. So with very little pressure, you'll see just the gland open up very slightly. And you can actually count the amount of meibomian gland orifices that are patent and allow meibum to come out. So that's one. And on the bottom, what you're doing is actual meibomian gland expression, and that will allow you to see the quality of the meibum that is coming out. So you can see how the top one, the meibomian gland evaluator, is more quantitative because it allows you to see which glands are more functional than others and count how many they are. And you can do this before and after treatment to also see how productive or how effective your treatment was. Whereas the bottom one is more qualitative. So you can see the consistency of the meibum that's coming out, and not necessarily counting glands, but more seeing the quality of the actual meibum. And again, this can be done before, after treatment to see how effective your treatments are. But both of these type of in-office expressions will provide us with completely different information, which will allow us to evaluate the meibomian glands. Other ways of evaluating meibomian glands, that this is one of my favorite ways, is going to be with meibomian gland imaging, also called meibography. So you can see on the right side, the top right, that it's being done with a transilluminator, which has been done for 50 years, very long time. This was the first way that people looked at meibomian glands before meibomian gland imaging existed. And you can see it's quite effective. You can actually see the glands in retroillumination here kind of light up, and you can see whether they're deformed or not pretty well. Obviously not as well as infrared imaging, which we have now, but definitely very effective in visualizing, especially before all this technology was present. So there's a lot of different ways now to show the meibomian glands, and I think it's such an excellent device to have if you're focused on dry eye, if dry eye is part of something that you want to get into, or even if you have a primary care office and want to address dry eye. This is something that is really magical because you not only as a physician can look at the meibomian glands and evaluate their structure, evaluate how much dropout you have, but you can also use these imaging to educate the patients and to show them. And that's the magic part about it, because showing patients where damage is so effective in promoting compliance. It's part of that education model that I was explaining at the beginning, the coaching model, where we're not just saying, here, you have this condition, use this product, or do this at home, or do this in the office, but you're showing them the damage. You're allowing them to understand. And when patients understand, they're way more likely to actually move forward with a treatment, and they're way more likely to be compliant with a treatment. So again, meibography is an extremely powerful tool that I highly recommend. And it is something that is very effective in promoting compliance with treatments and allowing patients will come back and they will say, hey, can you image my meibomian glands today? I want to see what they look like, compare them to last year. It is a great tool to also monitor the effect of treatments that we do, again, the before and after, to see how things look a year later, 6 months later, and follow patients this way. So highly recommend this. Other tools when evaluating the ocular surface, and this is really not using any extra time, is looking at the lid. So look your patients right in the eyelids is a campaign by Tarsus, which I love. And basically you can see on this patient all the deposits that are there in the eyelids in this promotional little video, but it's really quite effective to ask patients to look down. So if you look on the left side, you can see patients looking just straight ahead. And how you don't really notice anything, but as soon as you ask them to look down, you can really see the deposits, the collarettes, at the base, at the sleeving at the base of the lashes. which are really pathognomonic for Demodex. So Demodex blepharitis is visible with a slit lamp. We historically, or back when I was in school, we learned that we need a microscope, you have to stain it with fluorescein, you have to epilate it, all these things. And really all you have to ask a patient to do is look down, which realistically adds no extra time to a slit lamp examination. So it's really not asking the patient to close their eyes completely. It is just asking the patient to glance downward. And a lot of us do this already when we're fitting contact lenses, because part of evaluating a contact lens is asking the patient to look down so we can look at the superior edge. But for those that are not really working with contact lenses, asking patients to look down is really not something that maybe we're doing at the slit lamp, but it's so easy. And I just encourage everyone to do this while you're evaluating the ocular surface. So let's talk about the difference between hygiene and health. And Hygeia is a Greek goddess of hygiene. So we're getting a little bit into some Greek mythology here. But basically, like her sister Panacea, she went into medical school like her father, but really was focused on the promotion of health and the prevention of illness. So these are the two things that hygiene really is based on. When we think about health, we think about treatment or corrective measures to address a problem. But when we think about hygiene, we think of prevention. We think of doing things to actually prevent illness, to promote health, rather than treating something as it happens. So prophylaxis is hygiene, whereas health is maintaining a level of health or treating an illness, whereas hygiene is more prevention. And when we talk about prevention or promotion of health, what we're really talking about is things that people can do in their daily routines that they can incorporate in order to really prevent things from happening. So things that they can do, like washing their, again, hygiene, washing your hands to prevent, a contagion, to prevent microbes from being on the hands and getting in the eyes or in other areas. But in this case, cleaning the eyelids, cleaning the adnexa of the eye to prevent infection, to prevent dryness. So things that people can incorporate in their daily routine. So eye cleansing, again, we're talking about screening, we're talking about risk assessment, patient education, coaching. And so all of these things go into hygiene. So obviously a lot of the responsibility and the burden of hygiene goes onto the patient, but it is not without our evaluation, our screening, our risk assessment, our education. So helping patients understand what's going on and why they need to do certain things, and coaching them, which means following up, which means giving them a plan, right? And following up with them and make sure that they're compliant with that plan. So again, the final responsibility is on the patient, but we're responsible for them being motivated to do it and continuing to do it. So we have some friends that are really, really good at this, and these are our dental friends, right? Our dentists have been doing this forever. Hygiene is a huge part of dental health, right? And we all know this because we know we're supposed to go to the dentist every 6 months or every year, right? And they take pictures, they show it to us, and they promote things that we can do at home, right, to prevent gum illness, to prevent cavities. They even have consumables that are available in the office, like toothpaste, like dental sticks, like dental floss, things that we can do. And all of us take care of our teeth so well because these guys just really know how to show us what the issues are and how to outline how to prevent them so easily. And so it only makes sense that now that we have this technology where we can actually show our patients shadows like, dentists do, and show what loss looks like and show how to prevent that, this really is like the dental model. And we have so much that we can learn from them. And I always use the dental model as an analogy because a lot of patients become discouraged or like, well, how long do I have to do this for? And I'm like, well, how long do you have to brush your teeth for? And it's just like anything, if you do it sporadically, it doesn't really work. And another analogy that actually I had a patient that thought this was quite funny. It's like a fit guy. I live in Miami. A lot of people are fit here. And I was like, do you sporadically go to the gym? And it's like, no, you have to go every single day or multiple times a week in order to have the results that you want, right? So it's just like eyelid hygiene. If you really want to if you want to achieve eyelid health, then eyelid hygiene has to be something that is part of your daily routine, just like brushing your teeth is, just like flossing is. So it's really important to use the model that our dentists or friends are so good at and use it with our patients as well. So why is hygiene so important? So we know, obviously, meibomian gland dysfunction can lead to meibomian gland dropout. And we know that when meibomian glands atrophy, we're really, losing them. There's no way of really restoring a meibomian gland. And if enough glands are gone, well, there's really not going to be enough oil production. And we know that the lipid layer is an essential part of the tear film. And if the tear film's instability will lead to dry eye and inflammation of the ocular surface, and inflammation of the ocular surface will lead to more tear film instability. And it's just a vicious cycle that will render patients really unhappy. We know that the effect on quality of life is there so much that we have so many questionnaires available, right, to ask our patients about their quality of life. So we know that. But one of the main reasons that we also want to maintain hygiene is preoperative patients. So patients that we're referring out to our colleagues that are doing cataract surgery. Of course, there's about 70% of patients that are pre-op actually have blepharitis. And so what are we most afraid of is obviously endophthalmitis, which can lead to permanent vision loss. And the main cause of endophthalmitis is actually Staphylococcus, right? And Staphylococcus is caused by blepharitis. So, or Staphylococcus is part of blepharitis. And so if we maintain eyelid hygiene, we can actually prevent endophthalmitis. And so think of that importance as well. So obviously that's the worst case scenario, but it's so important that when we're sending our patients out for surgery, when patients are considering surgery, that eyelid hygiene is promoted, that is encouraged in order to obviously keep the area clean, keep symptoms low, because obviously any type of intraocular surgery can cause more inflammation on the ocular surface. How many patients do we have after cataract surgery that says, oh, now my eyes are dry because of cataract surgery? Most likely they had blepharitis, they had meibomian gland dysfunction prior to the surgery, obviously, but maybe it wasn't addressed properly or on time. So again, we want to prevent that, but the main reason or the most serious reason is to prevent permanent vision loss, which would be caused by endophthalmitis. So let's talk about education. Education is, as I mentioned, is one of the key parts of hygiene. And I mentioned that obviously the responsibility of hygiene is on our patients, but they really need to understand. And there's so many studies that show that when patients understand why they're doing something, they're so much more likely to do it. So there's really these 4 things that I think are things that patients should be doing at home in order to promote hygiene. Artificial tears are going to help flush out toxins from the ocular surface, just keep the ocular surface clean. Warm compress is a basic way to heat up the meibomian glands to allow to liquefy the oil so it can flow out more easily. And of course, cleaning the eyelash area, the eyelash margin, the eyelids, and taking nutraceuticals as well. These are all things that patients can be educated on. This is something that I really encourage all of you to stop doing. Hopefully you're not recommending baby shampoo anymore, or soap to clean the eyelids. And one of the things that this does is it can actually sting when it goes in the eye. especially if you're using it so close to the eye, it will definitely go in the eye. Even if a lot of these formulations are no tear formulations, it can still sting. But the main reason that we do not want to use baby shampoo is that it will actually destroy the lipid layer. Okay, so it actually does eradicate the lipid layer of the tear film. So it's really counterproductive. You're using this to clean the eyelids and to clean the eyelashes, but you're actually destroying the lipid layer of the tear film. So be really careful with this. I had actually a staff member recommend this to one of my patients. So just check with your staff also that they're not recommending this, because this is kind of like the oldest trick in the book type of thing, but it really is counterproductive. So just eliminate this from your treatment protocol. So what do we actually look for then in an eyelid cleanser? We want to have something that effectively removes eyelid crusts, because then we'll have a clinical improvement. This is something that we'll see when we examine our patients. We actually have them look down and see that there are less eyelid crust. So this will improve. Basically, those eyelid crusts do contribute to evaporation of the ocular surface. They do cause blepharitis. They can exacerbate meibomian gland dysfunction. So we want to effectively remove them. We want something to be pleasant and easy to use, which would encourage long-term compliance. For example, if you're using a wipe or a spray that feels really good, it might just be soothing. This is something that will encourage people to keep buying that product, to use it consistently. And, try to avoid things with preservative, parabens, perfume, and if you can't avoid preservatives, something with low toxicity, and this will help avoid side effects. So there are, I'm sure you guys have encountered patients who've tried different wipes or sprays, and they've commented that it feels like it's burning or it's uncomfortable. So definitely look for something else for those patients, maybe something lower toxicity for them. So again, effective removal of crust debris around the eyelid margin will help reduce the possibility of bacterial infections. And like I said, those crust and debris will have a negative effect on the meibomian glands, again, that cause and affect those interacting pathologies. So it just has an overall benefit to remove all of that. And so we talk about eyelid massage as well. So we know that cleaning with a massage has been shown to be more effective than just cleaning alone. And so if we can, we encourage our patients to massage after every cleaning. And there's a number of techniques for eyelid massage which help express blocked meibomian glands. So basically what you're asking them to do is just gently rub from the root of the eyelid to the margin. Obviously, they're not rubbing the eye, just the eyelid, with using a warm compress, or they could do a gentle pinching action on the eyelid, again, from root to margin. And what that will do is it will actually stimulate the meibomian glands, because it's one thing if you're cleaning and you're using a hot compress to liquefy the meibomian glands, but to liquefy the meibum and the meibomian glands. But if we're not expressing them, and I'll get into that shortly, but if we're not pinching or massaging, there's really minimal effect of warming it up. So actually, I'm going to get into that in a little bit. But let's talk a little bit more about the cleansing of the eyelids before we move into warm compresses. So again, there's a lot of different formulations. If our patients go on the pharmacy or they go on a website like Dry Eye Rescue, which you can see here, there's really so many different formulations and there are so many products. We're lucky that we have so many options. But how does one decide which is the best, right? And which one do you choose as a practitioner to recommend, right? Based on all these things that are available. So I think it's so important to really understand the difference between these products and also to tailor that to each patient. I don't have a formula that works for every single patient. You really have to understand the patient and also talk to them and discuss what their preference would be based on their lifestyle, based on you know, however they are. For example, some people are afraid of touching their eye, so maybe a spray for that person. So again, just try to understand your patient and how they are so that you can really customize the treatment for them. So there's different, again, formulations. There's solutions that are used for dissolving crusts. There's gels that basically will encourage mechanical removal. And there's also ready to use pads and foams. And so obviously, you know, it depends on your patient, and trying to understand what they need will help you really tailor the treatment. So there's a few active ingredients that I'd like to go over. The first is hypochlorous acid. So hypochlorous acid has been shown to be a very effective treatment in killing bacteria and controlling the biofilm around the eye. It can also help with allergies. And what I have patients do is I have them just take a cotton round and I have them spray it and just wipe their eyelash with it, or their eyelids with it. Another technique that they can do is you can actually have them spray their clean finger and have them put it on with their finger. And another way would be with a Q-tip. But you definitely need something in order to apply the solution. Hypochlorous acid was actually pioneered by Avenova, and it has a stable and pure solution for around the eye. So it's a really awesome solution. Again, hypochlorous acid is going to be something that you use in those patients that have a lot of deposits, blepharitis, a thick biofilm. This is going to be that type of patient that you want to recommend this to. Then there's those patients that maybe they don't have a lot of blepharitis, but maybe they have a lot of dry skin. They've got irritated eyelids. Maybe they just have more meibomian gland dysfunction, but not necessarily a lot of deposits. Maybe they have allergies or contact dermatitis or anything like that. This is going to be someone that I recommend hydration wipes to. So, or those patients that really wear a lot of makeup and use makeup remover. A lot of makeup removers don't have these active ingredients that help remove things and maintain eyelid hygiene. Their goal is really to remove the color and the makeup, right? So hydration wipes help reduce dry skin associated with itchy, irritated, inflamed eyelids. So if you have, you can also ask patients, I know we're not dermatologists, but we can also ask our patients, do you have their more oily skin, dry skin? If they're more dry, then a hydration wipe is really great. So hyaluronic acid, glycerin wipes such as iMed Pharma's Eyelid and Lash are great for hydrating dry, sensitive skin. I have a patient who actually recommended, a lot of them are so wet that you can actually just cut them in half and use half. So it depends, you know, every patient is different, as I mentioned, but whatever works for each person. And then you have eyelid wipes with tea tree oil. So this is, for example, such as Cleardex, which offer natural preservative way to clean the eyelashes, eyelids, and face to relieve symptoms of MGD, rosacea, and dry eyes. So we know that tea tree oil is a product that is formulated with 4-terpenol from tea tree oil to eliminate Demodex mites on the eyelids. We now have a solution that's out, an eye drop that's out that helps to eliminate Demodex. So that's also something that can be used. But tea tree oil is something that was the only treatment for a long time. So a lot of people are really, gung-ho about using their tea tree oil. Be careful with tea tree oil. If it gets in the eye, it does cause a lot of burning sometimes. So it's important to mention that to our patients. And hopefully they don't have those symptoms. But again, there is an eye drop out now that can help eradicate Demodex. So definitely look into that as well. This is a great tool that can also be used for eyelid hygiene. Again, very similar to our dental model, right? It's kind of like looks like a toothbrush, but what we do is we apply like a gel to this disposable piece and use the brush to clean the eyelash margin. So it's different than something like BlephX, which is done in the office, because BlephX is a little bit more rough, or a little bit more, the spinner brush is a little bit more quick and a little bit more rough. So if it does touch the eye, it could be a little bit more dangerous. Whereas the new Lids device is something that has been shown to be safe to use at home for patients. And it can be used actually with the eyes open, it can, or the eyes closed. So what you just saw demonstrated was someone using it with the eyes closed, but it can also be used with the eyes open and applied to each eyelid. So back to the new lids for a second. I just want to, so this is something that can be used twice a day. Again, if your patients prefer that, it's a great tool that you can have them. And just like an electric toothbrush, it's charged and it can be used again twice a day. So as promised, let's get into the hot compress. So hot compress is another tool that is used in order to promote hygiene of the eyelids. It is something that targets the meibomian glands, and the procedure will differ in detail depending on the medium and the product used, but the general principles are as follows. So it's going to be using a hot, but not too hot. We don't want to burn the skin, right? But it's a dampened compress or face cloth, and it should be held against the eyelid for about 5 minutes, 5 to 10 minutes. And basically this loosens scales on the eyelid margin and improves the fluidity of the meibum. But the problem is that warm compresses are poorly standardized treatment. There's new eyelid warming device that provides constant and controlled moist heat therapy. So what happens in inflammation is that the meibum in the meibomian glands will become more solid, and it will not come out, it will not be secreted as easily from the meibomian glands. And so what inflammation causes is the melting point of the meibum to be that of above the temperature of the eyelid. And so what we do with a hot compress is we try to melt that meibum so that it can be released, because when it's solid, it causes blocking of the glands, right? And blocking of the glands can lead to meibomian gland dysfunction, which can lead to meibomian gland dropout. And all of that can lead to evaporation of the tears. So again, inflammation causes that melting point of the meibum to increase to above that of the temperature of the eyelid. And so the warm compress is aimed at melting the meibum. But the problem is that we know that as soon, let's say you have a microwavable compress, or you have something that you heat up like a dampened compress or a face cloth, we know that at the beginning it's going to be very hot, but the temperature exponentially decreases with time. And so over the 5 minutes, you're really not getting the amount of heat needed to melt the meibum properly. That's one. There's studies that show that the compress would have to be heated and reapplied every 2 minutes for 10 minutes in order to have the same effect that some of our in-office treatments have. The other problem is that we know that meibomian gland dysfunction causes tear film instability, which causes inflammation. And we know that heat also exacerbates inflammation. Think about it. If you have an injury, you're putting ice on it, right, to decrease inflammation. So the problem a lot of the time with hot compress is that it heats the entire eye. And so yes, it will melt the meibum, but it will heat the entire eye as well. And so it can actually temporarily increase inflammation. So it's counterproductive in that case. And the other thing, the key thing, is that a lot of the treatments that we do in the office, which I'll talk about and show you in a minute, are also going to be evacuating the meibomian glands. So it's one thing to heat it, but it's important also to express the glands so that that meibum can come out, which restores the function of the glands and allows them to produce regular meibum again. So when we're just doing hot compress at home, we're not expressing the glands. And so that's another main issue with a hot compress done at home compared to the treatments in the office. So here's a bunch of different ones that we can do. So Mibaflow on the top left, and we have Lipoflow on the top right. So Lipoflow is a really great treatment because it has an activator that goes just over the ocular surface underneath the eyelid. It heats the meibomian glands at a controlled temperature for a set amount of time while protecting the ocular surface. So the cornea does not increase in temperature according to studies at all. We also have IPL, we have tear care. Tear care is very similar to Lipoflow, but a little bit less invasive because it doesn't go inside the eye. And it does heat the upper and lower eyelid. It directs heat exactly where it needs to go in the meibomian glands, and it does not touch the ocular surface at all. And again, maintaining that level of temperature that's necessary to melt the meibum for a set amount of time. And so there's no fluctuation of temperature. And then, of course, IPL, which is aimed at stimulating the meibomian glands and reducing telangiectasia. So all of these treatments are definitely superior to a lot of the at-home treatments. And if you have a patient that is looking, or that you identify as requiring eyelid hygiene protocol, then I would definitely recommend one of these treatments or more, a combination of these treatments to them. So blinking exercises sounds really silly, but it is not. So we know that a lot of patients don't blink enough, and this is an ongoing issue, mainly because most people are spending time in front of our screens like we are doing right now. And the studies show that when we're concentrated in front of a screen, we really don't blink enough or sometimes at all. So we're supposed to blink about 12 to 15 times a minute. And when we're concentrated in front of a screen, about 2 to 3 times a minute, and sometimes not even. And one thing is the incomplete blink. So we know that when we're blinking completely, the eyelid is completely closed, there's a little pressure, and then you reopen. So a lot of our blinking exercises, a lot of the time when we do a treatment in the office, we recommend our patients do blinking exercises to completely close the eye. And that really stimulates the expression of the meibum from the meibomian glands, and then reopen. So something that I give my patients and really emphasize, even though it sounds silly because it's an involuntary movement. And this is something that I will give my patients, which like a post-treatment type of protocol that they can do at home, things I recommend. So I'll check things off depending on, their lifestyle. If there's someone that really works a lot on screens, 20-20-20 rule. There's someone that has a fan over their bed, definitely try to get them to turn off the fan. But if that's not an option, I do recommend sleep masks, sometimes gels at nighttime, and really just what is best for your patient, and checking off what they need. If they have contact lenses, then you want to give them separate contact lens instructions and whatnot. So it's important, again, to customize the treatments to each patient. This is a short video that I recorded showing how I implement eyelid hygiene in my office.
I'm Dr. Elise Kramer, and I am an optometrist. I specialize in ocular surface disease, dry eye, specialty contact lenses, and I work here in the Weston and Miami Contact Lens Institutes in South Florida. Being a dry eye expert, basically, and partnering with Dry Eye Rescue has definitely increased awareness in my office in dry eye with patients. It's improved compliance because I have all the products, I have the displays, and patients, when they come in the office, they feel like they're in a dry eye clinic. So a lot of patients will look up dry eye, they'll come here, and they'll feel like they're in the right place because of the aesthetic that Dry Eye Rescue provides for the office, and allowing all the inventory to be available to patients online to be able to get their products and also return for their follow-ups regularly. So in terms of awareness, yes, I do believe that Dry Eye Rescue has helped me increase awareness among my staff and also my patients for dry eye.
So you can see like how the office looks when you walk in there and you see a display like that. You really feel like, okay, this office does have things. This is a dry eye office. So it gives that feel. Dry Eye Rescue is something that I encourage you to partner with if you're getting into dry eye, because they do provide displays. If you don't have room in your office is not conducive to a display, that's okay. They also have tear pads that you can use, like you see right here. You can have these customized to the products that you want to recommend to your patients, and you can circle them. And you have this 10% off code you can offer patients, which will basically prevent them from getting this on other websites like Amazon, for example, where they could mistakenly get the wrong product or get something less expensive that may not be as beneficial for them. So the display in the office allows you to have inventory. I personally like to have a lot of the products I recommend in the office, not because I'm making such a huge profit on it. Obviously, it's great to make a little bit of extra money from selling products, but it's really about patients walking out with a plan, with a product that their doctor trusts. And what's nice is they don't feel like they're being pushed to get it, because you can always offer them the option to get it online. But what's most important to me is that they're getting the product I recommend, because I'm really studying what the issue is with each patient. And I'm trying to find the best products for that patient, again, based on their preference, their skin type, their lifestyle, their habits, everything. And so I don't want them to get something else necessarily. I want them to use a product that I have, that I can recommend, that they can easily get. And so this display, again, it changes the aesthetic of your office, making your office look a little bit more like a dry eye clinic, but allowing them also to find the products online if they don't want to get it at your office, or if they run out of the products and they can't come back or don't have a follow-up scheduled yet. So definitely highly recommend this. And these are two of our awesome colleagues actively in action, educating their patients. I love these photos because education is one of the most important parts of eyelid hygiene. Patients need education to understand their disorder, and it really encourages them to persist with daily eyelid hygiene. If patients understand the underlying mechanism of eyelid cleaning and massage, they are way more likely to comply with it. Just like when we look at our teeth on the infrared imaging or scan or x-ray that we do at our dentist, we understand why we need to do what we need to do. Eyelid hygiene can also be considered as a preventive means to maintain eyelid health. Obviously, health is the ultimate goal, and hygiene is a means to get there, because it promotes health and it prevents illness and injury. So how do I follow up these patients? This is my guideline. This is not based on a study. So really just what I do, what has worked for me and my patients in my practice. So if they're mild, I'm comfortable seeing them every 8 to 12 months. If they're more moderate dry eye or blepharitis or eyelid issues, every 4 to 6 months. And if it's really severe, 1 to 3 months, and definitely weekly during a flare-up. So I just showed a spreadsheet type of example that I share with my manager. And basically what I'll do is I'll put the patient's name down. I'll put their treatment date. I always have my manager call them the day after the treatment to make sure that they're okay, to see how they're feeling. And then I also write when I would like to see this patient next. And I have the manager schedule that based on the severity of the case and also what treatment was done. A lot of the time they will leave the office with a follow-up already scheduled, but just in case, it's good to have it on a spreadsheet so that these patients don't get lost in translation. again, part of coaching is really following up with your patients and making sure that you remind them of the products and remind them of what needs to be done. It's not that patients forget, it's just that there are so many priorities, and a lot of these treatments are time consuming, like the hot compress twice a day. It can be a lot. So really just making sure that the patients are keeping up with the treatments that we recommend. So to conclude, eye care practitioners play a really important role in helping patients persist with routine eyelid care. It may be long-term or lifelong, and I don't think it should be like a death sentence. It should be something that is just explaining to patients that if it's done sporadically, it won't work. It's going to be part of the daily routine. We'll find a way to make it so that it's not cumbersome, so that it's even pleasant, so that they enjoy it because they're going to see the benefits of doing it, right? A number of preparations exist to make routine eyelid care both more effective and more pleasant, and that will improve compliance. And as I mentioned, because of all the different preparations on the market and different ingredients, it's important to understand your patients, what they need, and really customize the treatment to each patient. There's no one size fits all. Patients need help in selecting the most appropriate eye care products. So don't just tell them, clean your eyelids and do a massage and do, hot compress. Really walk them through the products, explain to them why you're choosing the specific ingredient that you're choosing, explain to them the formulation. Why are you choosing a foam? Why are you choosing a spray for them? Why are you choosing a wipe? Explain to them why, and explain why this is the best product for them in their lifestyle. Eye care practitioners can suggest products which suit the particular lifestyle of the patient and which make daily routine of eyelid hygiene easier and more effective.